A buffalo that stops urinating is always a serious and life-threatening condition, especially if it continues for several days. In this case, the buffalo had not passed urine for approximately 15 days. Initially, some treatment was provided by a local practitioner, but unfortunately, the condition did not improve. Instead, the situation worsened and progressed to complete anuria, meaning total absence of urination. Due to this prolonged obstruction, severe internal complications developed, which ultimately required emergency surgical intervention. Welcome to Nova Vet Care. In today's video, we will walk you through a real life case of urinary obstruction in a buffalo, leading to bladder rupture and how we managed it successfully through tube cystotomy surgery. When the animal was presented, it showed clear signs of distress. There was complete absence of urination along with abdominal enlargement and discomfort. The buffalo appeared dull, weak, and reluctant to move. Due to continuous pressure from retained urine, the urinary bladder became over-distended. Eventually, the bladder could not withstand the pressure and ruptured, allowing urine to leak into the abdominal cavity. This condition is known as uroperitoneum and is extremely dangerous if it not treated immediately. Eventually, the bladder could not withstand the pressure and ruptured, allowing urine to leak into the abdominal cavity. This condition is known as uroperitoneum and is extremely dangerous if not treated immediately. At this stage, medical treatment alone is not sufficient and surgical correction becomes necessary. The first step is surgical management is proper preparation of the animal. The buffalo is carefully restrained to ensure safety for both the animal and the surgical team. The pelvic and lower abdominal region is shaved thoroughly to remove hair and reduce contamination. After shaving, the area is cleaned using antiseptic solutions such as povidone iodine. This step is repeated multiple times to ensure proper aseptic conditions. Maintaining hygiene during surgery is extremely important to prevent post-operative infections. Once the surgical site is prepared, local anesthesia is administered. A line block or ring block technique is used around the incision site. This ensures that the animal does not feel pain during the procedure. It is important to wait for sufficient time so that the anesthesia takes full effect. Proper anesthesia not only reduces pain but also allows the surgeon to perform the procedure smoothly. At around 1.5 minutes in the video, you can observe this step being performed. After confirming adequate anesthesia, the surgical incision is made. A scalpel is used to create a clean and precise cut over the selected area. The skin is carefully opened, followed by separation of subcutaneous tissues. At around 2.4 minutes in the video, the incision becomes clearly visible. Next, the muscle layers are incised carefully to access the abdominal cavity. These steps requires precision to avoid damage to internal structures. Proper techniques ensures safe entry into the abdomen. Proper technique ensures safe entry into the abdomen. Upon entering the abdominal cavity, a large amount of urine is countered. This is due to rupture of the urinary bladder, allowing urine to accumulate freely inside the abdomen. In this particular case, approximately 20 liters of urine were removed. This step is extremely important to relieve internal pressure and reduce toxicity. The accumulated urine is carefully drained and the cavity is cleaned. At around 3.5 minutes of the surgery, this critical step can be observed. This confirms the diagnosis of bladder rupture. This restores the structural integrity of the abdominal wall. Next, the subcutaneous tissues are closed.
After removing the accumulated urine from the abdominal cavity, retention is directed toward the ruptured urinary bladder. The bladder is carefully identified and rupture site is examined. Before suturing, the ears of the bladder are cleaned gently to remove contamination. Now, a Foley catheter is introduced into the bladder to establish continuous urine drainage. The catheter is inserted carefully and positioned properly inside the bladder lumen. Once placed, the balloon of the Foley catheter is inflated using sterile saline water to secure it in position. This prevents the catheter from slipping out and ensure continuous drainage. After secure the catheter, suturing of the bladder is started. The bladder wall is sutured using an appropriate absorbable suture material in a continuous pattern to ensure a leak-proof closure. Care is taken to avoid tension and ensure proper alignment of tissue. Once the bladder is closed, the abdominal cavity is checked again for any leakage. Then close the muscle layer is properly carefully to restore abdominal strength. After that, the peritoneum is sutured to re-establish the intestinal lining. Finally, the skin is sutured using proper technique to complete the surgical procedure. Throughout this procedure, antiseptic precautions are maintained to prevent infection and ensure proper healing.
Finally, the skin is sutured using appropriate techniques. At around 8 minutes in the video, suturing is completed. Layer by layer, closure reduces the risk of complications such as infection of hernia formation. Post-operative care plays a vital role in recovery. Broad-spectrum antibiotics are administered to prevent infection. Anti-inflammatory drugs help reduce pain and swelling. Fluid therapy is provided to correct dehydration and electrolyte imbalance. The surgical site should be kept clean and monitored daily. The animal should be given proper nutrition and a stress-free environment. With proper care, even severe cases like this can recover successfully. This case clearly demonstrates how delayed treatment of urinary obstruction can lead to life-threatening complications like bladder rupture. Timely surgical intervention and proper management can save the life of the animal. For more real-life veterinary surgical cases and practical knowledge, subscribe to Nova Vet Care and stay connected.